community hospitals and larger hospitals were closing a lot of their programs to address racial disparities because they don't have enough money to cover the operating cost of hospitals and clinics because they're giving money for subsidies to private insurance. Katie Robinson from Healthcare Now was part of a briefing up here that dealt with the Massachusetts exchange model. But one of the things, how many of you guys went to college? Raise your hand. College. How about graduate school? Raise your hand. Very good. What we learned in graduate school and college was to seek the truth, right? To look at policy from an objective and rational point of view, and not to accept any kind of maybe political, how should I say this? But to really look and see if something works, not based on what's political, but based on what works and what does not work. So today, you will hear from nationally recognized advocates of universal single-payer health care, others called Improved and Expanded Medicare for All, on where we go here for universal single-payer, both in terms of policy and movement building. Now, Representative Dennis Kucinich is supposed to be here. But today we have Mark Dudzik, National Coordinator, Labor Campaign for Single Payer, Tim Carpenter, National Director, Progressive Democrats of America, Katie Robbins, National Coordinator, Healthcare Now. Dr. David Raymond from Georgetown Medical School will be here at around 4:15, 4:30. Joe Jerczak from National Nurses United, unfortunately, will not be able to be here. So without further ado, Mark, if you can come, you can either speak from here or from, rather you come up to the podium and just give us your thoughts. Thanks.
Good afternoon.
How's everybody today?
Great.
Today is Workers' Memorial Day, and I would just ask you, before we begin, just to take a moment to remember the struggles of working people, the 29 coal miners from West Virginia who died in the last month, the 7 refinery workers from Washington State, and the 11 oil rig workers in the Gulf of Mexico who are missing today and presumed dead, and the thousands of people who die every year from occupational illnesses that they incur on the job. So I would just ask that we just take one brief moment and bow our heads in remembrance of those souls. Okay, thank you. And they, like all Americans, are crying out for a real health care, and showed that it is possible to move health care issues through Congress in the face of sustained opposition and almost unanimous opposition from a political party and a whole industry. We moved those bills. These bills were moved through Congress. In the midst of that, some of us had said from the very beginning that despite whatever compromises you make in the design or the intent of these bills, you're going to end up having to fight the same battle as you would if you didn't make those compromises. But nonetheless, the bills passed in the face of sustained opposition. So health care reform, despite whatever the conventional wisdom of the last 25 years is, health care reform is possible. And, I'm not here to debate the merits of those bills. I recognize that they've accomplished many good things and will affect the most viable and effective solution to that mission that we have as activists, to create health care as a right for all in America. But I come here today with good news. In addition to whatever happened here in Washington, that the movement that emerged from these debates over health care reform, the movement for a single-payer Medicare for all solution, has ended those debates stronger than it was when those debates began. The idea of a single-payer system won the battle of ideas. It emerged as the gold standard during the debates. Even the opponents of any health care reform, if you read the newspaper articles or listened to the speeches, everybody said, well, in order to do that, in order to cover everyone, you'd have to have a single-payer system. In order to control the costs, you'd have to have a single-payer system. So we can't have that, so this does this and this, but it's not quite as good as a single-payer. We won the battle of ideas. It was conceded universally as the only real effective way to deliver health care in this country. We also educated millions of Americans about the nature of healthcare politics and about what is needed to reform healthcare. In the labor movement, the AFL-CIO last fall, in the midst of these debates, passed a historic resolution that puts it on record as being committed to a single-payer solution in the long haul, and I think that that is very expansion of entitlements as opposed to constantly playing defense. Why can't we talk about moving Social Security down in age? What would happen if people could retire at age 62 with full medical coverage? What would that do for the job crisis in this country? How many young people graduating from college today would have an opportunity to start a new career rather than being warehoused in their parents' basement during this economic crisis? This is an opportunity to take the offensive, to find new allies and to bring them into a relationship. Medicare is the only single-payer system that we have. We have to defend and expand that, both for its current recipients and for all Americans. The way to solve the financial health of Medicare is to expand it to all Americans, not to cut its benefits and contract it and restrict its ability to do its job. So we have to open that front up, and we have to do that in a very strategic way and look at opportunities. If we could move Medicare eligibility down, it's a type of incremental reform that makes sense because it doesn't increase the power of the private for-profit insurance industry and the rest of the healthcare industry. It increases the constituency of Americans for a single-payer system. Likewise, we have to support the fronts that are open, viable campaigns in states around the country to establish state level. Had a lot of debates within the single-payer Medicare for all movement that there are formidable questions and problems about instituting at a state level rather than a national level. But that is where people are choosing to fight. There are places like California, which has passed a single-payer bill through both houses of its legislature twice now. Governor Schwarzenegger has vetoed it. He's not going to be governor much longer. In Vermont, they just passed a bill to set up a study commission that will come out with a proposal for a single-payer plan in Vermont sometime within the next, I forget the time period.
Thank you very much, and to John Conyers, thank you for your ongoing commitment to single-payer, and it's been a privilege to work with you over the last 7-8 years on this issue. Your leadership has been essential, and I'm glad that we're gathering here with the idea of recommitting ourselves to the effort ahead, which will be one which will require, as has been stated, a degree of organization and reaching out to our friends in labor and community organizations and nurses and doctors organizations, student organizations. This is the time to do it. We have a new context within which to do it. The health insurance reform that occurred, as we all know, was reform of insurance within the context of a for-profit system. The truth of the matter is that single-payer was taken off the table from the beginning of this Congress. I know there are those who were concerned about the fact that there wasn't a vote on single-payer, which the Wiener Amendment promised to accomplish. The politics of that were very difficult because, as a practical matter, had the Wiener Amendment been brought to the floor in the climate in which we had, which were there were very few hearings about single-payer, which was one which was very discouraging and derogatory of single-payer, the Wiener Amendment would have been soundly defeated, and that would have been used as an excuse to tell us, look, we've already moved on that issue. No one wants it. Let's move on. So John and I have worked together to try to protect the aspirations of all of us who want to be able to move on single-payer with Mr. Wiener and others, so that we can do it in an environment where we can say, look, it hasn't been tested. It was taken off the table. We've never really had a test of it. And this gives us the chance to build the support and build it so it'll be strong enough that when the time comes, we won't be